first release is an ironing release that's going to work above and below the iliac crest. So it's going to take in the lumbar area, crossing the sacrospinalis muscle, quadratus, thoracostoral fascia, and into the transverse obliques, and then below it's going to be in through the glute group. And so we start off, we're working contralaterally. You sink in just adjacent, just above the ACIS and close in to the spinous processes. The other arm supports the pelvis to stop it turning with the pressure. And your ironing movement, which I'm going to do faster than we do clinically, so that when you see the film, it's easy to see what's happening. Basically follows the line of the iliac crest just above it. And we would do that 1 to 3 times. The second one works just following the iliac crest just below, from the edge of the sacrum, and it's going to work right round into the gluteus medius area. Again, I'm going probably a little faster, and again we would do this between 1 and 3 times. And this little sequence can be used with lower back pain, with either anterior or posterior tilt, and it helps to free up the pelvis in relation to the spine. So also if someone's very stuck in the S1, L5 kind of area, this would be part of the process of freeing them up. We can also do the 2 lines together. You can't stabilise the pelvis as well with this, but it's still, you can still get an effective release. So that's 1 elbow, 1 forearm either side of the iliac crest. It's an area where you get a lot of rough, ropey corrie, so we've been following that line. Okay, coming on to the gluteus maximus, you may be able to do an ironing movement. You may be easier to wait out the tension, depending whether you can glide across someone's underwear or not. The technique is slightly different in that you're not ironing along the line of the ulnar bone, you're ironing across using the broad width of the forearm. So find the line of the edge of the sacrum and sink in, and then if we're doing this as waiting out the tension, depth barrier, linear barrier, and we just lean into it and wait for a release. If we're doing this as an ironing movement, we can begin to glide very, very slowly towards the attachments of the gluteus muscle at the top of the femur. So again, between 1 and 3 repetitions. Other things we can fit in conveniently at this stage is to use chiseling movements to stretch and spread the fascia over the sacrum and over the sacroiliac joint. So one hand stabilises the other. We can do a finger chisel with short oblique strokes. And we can take this right down towards the coccyx, or we can do a chisel with the knuckles. The strokes are short, but a very good line to follow is to get the, so we actually go over the SI joint, over the very back part of the iliac crest onto the gluteal muscle. So we have all that bit. While he's still lying supine, I'll show you the release for the piriformis and the other external rotators of the hip. So we have gluteus minimus, piriformis, gemellus obturata as a fan round like that. And if we focus initially on piriformis, elbow into piriformis, or forearm, pick up the leg and keeping the pressure into the muscle, we can then take it further into external rotation and into internal rotation. So this is what I describe as a wedging release, in that we're combining a pressure technique and a mobilization technique. The pressure technique is like a wedge into the muscle. That forces the actual tissue, the fascial tissue, to stretch more while we are moving the joint. Do that for between about 10 seconds and half a minute. And we can, wherever we feel tightness in the rotator group, we can just readjust the position of the forearm. So we can go around the whole rotator group. Medius. We'll do this with the leg nice and straight. We're basically targeting between the greater trochanter and the ACIS, often very, very tight, tender little band of muscle, and just in front you have the tensor lata fascia, and you can actually contact both of them from this position. The leg is straight, and we create a little distraction or traction, stabilizing the leg with one arm. The forearm goes in, finds the depth, and puts a little downward in that direction. Stretch, and there, from that position, we wait out the tension. We hold that for until we feel a release or something in the 15 to 90 second kind of time frame. And following the releases as the muscle releases, changing the angle of the forearm to bring it a little more anterior will take us into tensor lata fascia. And of course we have a little stretch from the other hand going through the ITB. So that's actually beginning to have an effect right down the ITB as we do that. So as pick up the leg, ease some fingers in, just medial and a little superior to the ACIS. Bring the leg up, and as you palpate backwards and forwards, just bring your t-shirt up so we can see more clearly. Feel for a tight band of muscle that's running obliquely towards the spine, up like that. If you can't feel it, you ask the person to pull their knee up towards their chest, which will contract the muscle, and you should feel it more clearly, and then get them to relax. The actual release is to keep a very sensitive, active pressure into the tissue of the psoas muscle, and as you do, gently mobilize the leg. What this will be doing is creating a little bit of stretch and release of stretch in the muscle in combination with the pressure. And you can also get it in a higher position, come lateral to the rectus into the stomach 25 area. Bring the leg across the body away from you. Again, get him to pull his knee to his chest till you can palpate the muscle. Once you've got it, he can relax, and you keep similar kind of pressure in there. Be very sure that you're not just pressing on the aorta. As I said to you the first time, if it's pulsing, it's not the psoas muscle. If you feel the pulsation, you need to come a little bit normally medial to actually find the muscle. So the same mobilization. When you've done both of these, a good way to finish off is to take the leg down off the edge of the couch, stabilize the pelvis, and put a fascial stretch through the thigh, which is going to create a broad opening of the fascia along the line of the psoas muscle. We've said before, this is not a strong psoas muscle stretch, but it's allowing the psoas muscle to be in a long open position, which will help to integrate and consolidate the release that you've just done. Something I mentioned at the end of yesterday, for people for whom that's too strong a psoas release, you can get a very low impact psoas release just by taking the hip into flexion and taking it back out and adding a little traction, distraction at the end of the movement. This is not going to dramatically stretch the psoas muscle, but it's going to create an awareness and activation in the muscle that is going to very gently help it to lengthen and release. So that's a very, very low impact psoas muscle bit of work. Last thing to say is, though you ideally want to contact the psoas muscle, if the hara is very congested, you may not be able to get in that deep. Take your time to work your way in. If there's congestion, stop at the barrier. Even if you can't palpate the muscle, do the release in the vicinity of the muscle. Something may well happen. You may, if someone's very congested in their abdomen, need to do a lot of hara clearing before you can do the psoas release.